So Pamela and Melanie, whenever you are ready.
All right, welcome everyone. My name is Dr. Melanie Perreault. I'll be presenting with my colleague, Dr. Pamela Beach. I'm just gonna start sharing my screen in just a moment. All right, so today what we're gonna present on is kind of almost like the first part of a two-part series that we're going to be presenting over 2 webinars. So the first one that we're presenting today focuses on very young children. So we're going to be focusing mainly on motor milestones, which occur during the first year of life. Dr. Beach and I are both at SUNY Brockport. We are faculty there. I'm an associate professor of motor behavior, and Dr. Beach is a professor of motor behavior and also the associate director for the Honors College. We are also both affiliated with the Institute of Movement Studies for individuals with visual impairments or deaf blindness. Dr. Beach is one of the co-directors, and I serve as the communications director. So we just want to start off with giving a little bit of information about our institute. So it is housed at SUNY Brockport, but it expands, our work expands across the country as well as across the world. So we focus on basically 4 main pillars within our institute, with a focus again on movement studies for individuals with visual impairment and deaf blindness. So one of our 4 pillars is leadership. So we provide a lot of leadership opportunities, especially for students who are studying adaptive physical activity or that might be studying other areas of motor behavior. We also do quite a bit of research in this area. We're going to present a little bit of it today. That's going to kind of help inform our talk. We also provide education on both what we study with our scholarship and its kind of translation into practice, which is kind of what we're doing today. And we also provide a variety of programs and services. One of our main programs is Camp Abilities. So Camp Abilities is actually going to be starting up in a few weeks for us, but there are several other camps across the United States, as well as in several countries across the world. So I first want to provide a little bit of context for our talk today to really reiterate why these foundational skills are so important to look at and why it's so important to make sure that children are meeting a lot of these early milestones when it comes to motor development. So for those of you who are able to see the screen, what I have represented there is basically like a pyramid shape, and this represents a common framework within our field called the mountain of motor development. So at the very base of this pyramid or this mountain is our reflexive period. So this is really from birth to about the first 2 weeks of life, and it's really represented by the various reflexes that you'll see in an infant. So for instance, the rooting reflex, the sucking reflex, the stepping reflex, all of those are kind of included within that. So these are not voluntary actions at this point, but they serve as a foundation for the next period, which is known as the pre-adaptive period. So this occurs between the first 2 weeks up to a year or about that. And it really focuses on a lot of those motor milestones that we're going to be talking about today. So things like rolling over, pulling to stand, and then kind of the final piece of that is independent walking. And then from there, it leads up into our fundamental motor patterns, which focus more on running, jumping, include ball skills as well, such as throwing and catching, kicking. And then once a certain level of proficiency is passed, and we call that the proficiency barrier, children usually move on to more context-specific motor skills, such as performing a throw within context, such as playing baseball or softball. And then from there, with further practice and instruction, they can gain a really high level of skillfulness, which is represented at the peak of our mountain there. So we want all of our learners or all of our children to kind of progress to a point where they can at least perform a variety of motor skills so that they can live a very healthy lifestyle, both for physical activity and just general well-being as well, because there's a lot of benefits of physical activity beyond just the physical. There's a lot of social implications, their emotional development, etc. So we're focusing this particular webinar on looking at that pre-adaptive period. So those motor milestones that every parent is really looking for in that first year of life, and ensuring that all children meet those so that they can progress up to those fundamental motor patterns. So motor milestones, like I mentioned, they are different than the reflexes. So reflexes are very involuntary. So they just happen naturally depending on what stimuli is presented. With motor milestones, we're talking about the first kind of voluntary goal-directed movement behavior for these infants. And they usually follow a kind of typical progression. Some of the steps can be, or some of the milestones can be skipped, but generally we see the sequence kind of stays consistent across children. However, there's a lot of variety on when individuals will present each of these particular skills. So even though I'm going to give you, and Pam will give you as well, some ages, don't think of them as rules, like your child has to meet this particular milestone by this particular age. There's a lot of variation. And then motor milestones typically follow a cephalocaudal direction. And that basically is just a big word that means head to toe. So generally what we see, and I'll show you a progression in just a minute, is that a lot of the early milestones focus on the head control, being able to lift the head up, and then kind of progress down from there towards the legs, which is where we end with independent walking. And then each of these milestones, as they follow this progression, really build on each other towards subsequent movements. So this is a typical kind of motor milestone sequence. And what I'm going to present to you first is for typically developing children. Pam is going to present some information relative to those with visual impairments and deaf blindness to see kind of how it contrasts a little bit. But I want to at least kind of get everybody on the same page as far as the sequence that this typically follows. So early on, we see again that cephalocaudal pattern where the first kind of milestone we see is the ability to hold the chin and the chest up. This is predominantly done with using, tummy time, where you flip the child over on their belly. And so they practice kind of strengthening those neck muscles, and eventually to the point where they can lift up and lift their chest off and kind of move their head around. Then we progress up to rolling over. So this could be from back to belly or belly to back. Then we move on to sitting with support. So for example, if you're using like a boppy or a bumpo seat or something along those lines, the child can sit up in it, but they have that extra support to kind of keep them upright. Next, they move into the sitting without support. And then finally moving on to standing phases. So standing while holding on, and then the ability to pull themselves up to stand, standing alone without any support, and then finally progressing to walking. So here's just an example of what I meant by kind of these early milestones with the head. So this is a child, there's a picture on the screen of a child who's on his belly and he's holding his head up. Doesn't quite fully have his chest up, but is starting to do that. But this is a really good indication that he's progressing enough where he can start looking around at his environment. And then the next picture I have on the screen is a child who is actively rolling over. So again, this is around that 5-month mark. And then also at this point, we see that the child sits kind of supported. So here's just an example of what rolling over looks like. So I have a video on the screen. So there's a young child and she's going to be rolling from her back to her belly. Let me show that to you. So this rolling over is definitely important because it is almost a first kind of step towards locomotion in its way. I have seen kids before use that as a way to kind of navigate across the floor, but they can start to get from one location to the next. Another thing that's really a milestone, it doesn't necessarily relate to what I showed you earlier, but it kind of comes with being able to sit up. Okay, so when you're able to sit up as an infant, it opens up basically an entire new world to where they can start to interact with their environment more. So one of the things they'll be able to start developing is reaching and grasping. So reaching and grasping, it occurs really rapidly over the first 8 months, but in particular, we see a lot of it once they're able to sit up so they can manipulate objects more. But it is a quite challenging skill because there's a lot of integration of different sensory components. There's haptic, being able to feel objects, as well as the visual perception of locating them, and then trying to coordinate that with the motor system as well. And it's usually a product of both intrinsic and extrinsic factors. So for example, it just could be motivation to reach something that seems interesting, but it could also occur because of some encouragement by an external source, such as a parent or a caregiver. And then with locomotion, it really progresses kind of in these 3 C's, though some children can skip some of these. So the first one, as far as being able to move from one location to the next, is crawling. And crawling isn't what we naturally think of as kind of the common term that we use. In motor development, crawling refers to where the infant has their belly actually on the ground. So it's almost kind of like a commando crawl a little bit. So they're using mostly their arms and they're not really necessarily using their lower body at this point. And then they'll eventually progress to creeping. So creeping begins around 9 months. So creeping is what we commonly think of as crawling. So this is where your belly is no longer in contact with the floor. And then we move to cruising, which again is between about 8 to 11 months. And this is where the individual is holding on with their arms to some sort of support surface as they're moving, usually laterally along with whatever object. So for example, they might be holding onto a couch and they're able to navigate laterally around the perimeter of the couch while still maintaining contact with their arms. So on the screen, you'll see just kind of a representation what each of these looks like. So again, crawling, we have on the belly, belly still on the ground, creeping, belly is up off the ground, cruising, holding onto a supporting surface, moving around laterally, and then finally progressing to walking alone. And then on the screen, we just have some pictures to represent these. So some of these are actually Dr. Beach's daughter, Harper. So the top picture, there is a picture where she's got her belly on the ground, but is moving around in that commando crawl. So that's our crawling. The next picture down shows her with her belly off the ground. So that's the creeping. And then finally we have cruising down at the bottom where she is supporting herself by holding on to this little like fake rock wall that you would navigate on. Another one we haven't mentioned yet is the bear crawl. Sometimes this can happen between crawling and walking where the infant is actually not using their knees anymore while in kind of a crawling posture. So their arms are straight out and the legs are also straight out. So the knees are no longer in contact with the surface of the ground. Then we have standing alone and walking with assistance. So walking with assistance could include some of these like walkers. So there's a picture of a baby walking with a walker. And then there's another picture with, holding on to fingers of a caregiver. And then finally, we have the independent walking where we no longer need support. I'm going to turn it over to Pam.
All right. Hi, everyone. Thank you for attending. This is Pam Beach. So I'm going to talk a little bit about, so Melanie was focusing more on typical development, and I'll get into more of motor milestones with infants who are visually impaired and blind, and also a little bit on some of our research with children that have charge syndrome. So typically what's found with young children who are blind is a lot of delays, particularly in fine motor skills, as well as locomotor. So you're crawling, creeping, cruising, and of course, independent walking. A lot of studies have found about a 6-month delay in independent walking. Again, there's a lot of variation, as there is a lot of variation in the severity of the visual impairment or the onset or additional disabilities as well. So in developmental fields that require no visual motor coordination, such as postural control or basic manual skills, so picking up, like reaching and grasping and picking up objects, infants that are about 9 or 12 months who are blind were not able to achieve the level of development of sighted infants, so they still tend to be behind in those even without the visual motor coordination requirements. Some of the cause for the delayed acquisition of fine motor and locomotor has to do more with the fact that of cognitive prerequisites, which allow the infants who are blind to replace a visual motor coordination with more of an audio proprioceptive, so the hearing and touching coordination, as opposed to the seeing and how that affects movement to control movement. But they found that this is still lacking in this particular age. All right, so I want to talk a little bit about some of our research with charge syndrome, and in case you're not familiar with charge syndrome. So charge syndrome, charge is an acronym, which stands for, I have it on the screen, colobomas, heart defects, atresia of Coyne, restriction of growth, genital abnormalities, and ear abnormalities. So again, it's genetic, and there's a huge variation across all individuals with charge syndrome. So some have all of those, some have some more minor characteristics, and again, there's a lot of differences across them. So we did look at some of their motor milestones. I'd like to just mention this is parental report, so might not be completely accurate, but parents were reporting when they were able to hold their head, roll over, sit without support, crawling, creeping. Creeping again is crawling with the abdomen elevated, standing with support and without support, cruising, and then walking. And across the board, we found significant delays. And the walking, we had a lot less data because a lot of the participants were not even independently walking yet. So as far as independent walking, just keep in mind that this is a very complex task. I'm sure I'm speaking to the choir, anyone that's worked on helping a young infant to be able to walk, particularly if they have some sensory and or motor deficits, can be really difficult. So they have to have the musculature to support them in that upright stance. They have to be able to have the balance, the coordination components. And one challenging factor with young children who are blind or visually impaired is that motivating factor. So seeing something that they want to go and grab or play with, and also seeing a sibling and how they're moving and how much they're moving, that can be a huge motivator that that they can be lacking. So always keeping that in mind. So we find that children with visual impairments are about 6 months behind, but children with charge might not be walking until ages 3 to 5 is not too uncommon. We also looked at balance in children with charge syndrome. We looked at kids around age 9, and on average, they were walking around 42 months, whereas the controls, the typically developing children, were walking around 13 and a half months. We looked into things like how often they had fallen. So most of them had fallen. So within that past year, and a lot of them indicated a fear of falling. So some of that, if they're not feeling stable, they're going to be much more likely to fall and worry about falling. And 9 of them used a mobility aid. We looked at their PBS score, which was really if they were at risk for falling. So looking at kind of their confidence with doing a variety of different tasks. And we found that their confidence was correlated with how they actually perform. So their ABC scores has to do with their actual balance performance. So if they worried about their balance or had a higher fear, then that did negatively affect their ability to maintain balance. This is just a little more, we did another study on walking and balance in children with CHARGE syndrome. And we wanted to see kind of break down the types of balance. So we looked at a variety of different types of balance, including anticipatory, which is when you're controlling your balance. So eyes open versus eyes closed, standing with one foot, standing tandem stance, one foot in front of the other. And so reactive balance is more your response to, for example, an unexpected perturbation, like you hit something, or there's a change in the environment and you weren't expecting that. And then sensory, getting into more changes in proprioceptive information. So standing on like an incline or soft surface, and dynamic is more your gait. So how you control your balance through motion and walking. So, and I have a photo of me working with a little girl, I think she was 4, she had CHARGE syndrome, and I was just giving her some instructions for what she was going to do next for her balance. All right, so what we found was that we looked at their physical activity levels, and they had very low physical activity levels. Their mean score was 2.3 out of 5, so they were not typically active, and that was just a report. So looking at how active they typically are across a week. And we wanted to see how their balance, their motor skills, and their physical activity, how they were associated with one another. And what we found, click on it again. So balance was not associated with their physical activity, which is a little bit surprising. So it was weakly correlated. And also the physical activity and motor skills were not associated, but there was a very strong correlation between balance and motor skills. So the better their balance, the better they were able to perform motor skills, which does make sense. So if we go back to that mountain of motor development, balance is going to be one of those lower levels that is going to help you to improve on all of those levels as you move up that mountain. So fundamental motor skills to more skillful activities. All right, so then I have just a so what. So these are the 4 different areas of balance that I was looking at, and the anticipatory control, which is typically one of the easier ones to do, so more basic balance. That was found to play the most important role in their fundamental motor skills. So I think if we just focus on the most basic aspects of balance, that was particularly important. So that's what our big findings were. We were expecting more like reactive postural control, how you're able to respond to something, but instead it's just that quiet standing that was most important. All right, so getting into affordances. So really what is going to affect how you're moving and growing and changing? So infants are acquiring motor milestones, and they're continuously growing and changing bodies. So once they start to get an idea for how to perform something, then it continuously is changing as they're getting a little taller and getting a little stronger, and all those changes force them to constantly learn to adapt their body to these changing environment. So environmental affordances can really change that acquisition, and also keep in mind the environment that you can set up. So having your surface, so having something that is soft, but non-slippery, and encouraging movement can really make a difference. All right, so these are some charts that are publicly available. We did not develop them, but I just wanted to share them. And I also wanted to just note that keep in mind that, again, these are just rough ages. And so a lot of children aren't going to necessarily hit these at these particular times, and everyone is different and unique. So keep that in mind. Also, many children with visual impairments and blindness don't crawl. They start walking without ever really going through that crawling period. A lot of them do kind of like that 5-point crawl where they're using their hands and their knees and their head as like a 5th point. So you might see a different variety. So, but just keep that in mind. So this is just giving kind of a rough idea of when to start seeing some of these different motor milestones. I'm not going to read them off because that would take too long, but we'll share this with you. But at the same point, crawling is really important developmentally because it is also developing some hip rotation, which is really important for walking. It's developing some of that abdominal strength. So it's just keep in mind that there's quite a lot of variety, and you probably find the most variety with things like crawling and creeping when they're going through those periods, what kinds of movements you're seeing. Sometimes that's just affected by the kinds of clothes they're wearing, the flooring that you might have. Some infants absolutely hate tummy time, so they kind of go through that stage more quickly because they're trying to avoid that, and they might opt for walking. So there's a lot of variety there. And then I have another chart that I'm sharing with fine motor. So it starts out with just playing with the hands and using those hands, and they are progressing to be able to control what they're doing with their hands and their fingers, and to the point where they can reach and grasp and manipulate objects, moving objects from one hand to the other. So just encouraging those kinds of activities, playing with some objects of different sizes, and encouraging them to play with those with both hands as well. We'll get into some more specifics with strategies in a minute.
All right, so this is Melanie again. So we want to move on and talk specifically about when infants are at risk. So obviously early identification of any movement problems is pretty important, especially at this stage where we want to make sure we get interventions in place that are going to be effective and helpful, knowing that it will, if they don't, these potential delays might persist. And so they might be behind continuously throughout their motor development. So it might potentially impede their ability to interact and do other types of skills in the future, such as our foundational skills. So one of the most important things is to find a very well-designed early intervention program that is based on evidence. So it needs to be something where there's been some research on it and it's been proven to be effective. And of course, early intervention is important as well, because in infancy and early childhood, that's where neural plasticity is at its maximum. So the ability to kind of make new connections and sort of reorganize the brain paths is going to have the most potential early on. So again, if you can get that early intervention in place, then odds are we can make really good progress moving up that mountain of motor development in the future. So one thing to take into consideration when looking for any type of intervention, we have some key points here about things you should consider. So the first thing is, do the interventions have proven efficacy? So I just mentioned how it's really important to make sure that these are backed up by evidence. So has there been any research done to indicate that these programs have been successful? The next thing you want to think about is how to identify the most important outcomes. What exactly do you want the child to be able to do by the end of the intervention? And as part of that, really coming up with good ways of setting goals that are going to meet those criteria of being specific, measurable, attainable, time bound. And so you want to make sure that those are in place so that you can monitor and track progress as the child is moving along through the intervention to make sure it's working, because there's no point in doing an intervention if it's not working. The next thing you want to consider is, do we have or are we using the appropriate or right assessment tools? So being able to use assessment tools that are going to accurately track the progress towards those goals is going to be very important as well. And then finally, is the intervention being carried out effectively and consistently? So is it being implemented in the way it's designed? And also, is it being implemented on a consistent basis? That's also very important as well. So before we talk about some of the specific ways that you can go about helping children meet these milestones, or maybe including some sort of intervention, I do want to talk a little bit about a model that we use in motor development to kind of describe why we see certain motor behaviors in individuals. And this can apply across the board, but obviously we're going to look specifically at this in relation to meeting those motor milestones early in life. So this is represented as a pyramid. This is known as Newell's model of constraints. At the top of the pyramid, what we have are the individual's constraints, or basically the individual's characteristics and how that can potentially influence their motor behavior. So there's two kind of categories here. The first one we have is structural. So this is aspects, physical aspects of the individual. So it could be, for instance, that they have a visual impairment, or they might have also an additional disability. Could be also their size, their strength as well. And then we also have functional aspects of the individual. So this could be how motivated the individual is. You know, we talked about putting objects in front of them. Are they motivated to actually reach for that particular object? Does it interest them? Then down at the bottom right-hand corner of the pyramid, we have our environmental constraints. And we kind of have two categories here as well. So there's the physical environment in which the individual is performing the activity. So Pam mentioned before about having like a surface that's non-slip, for instance. So that would be part of the physical environment that the child is in. We also have the social environment as well, which you as practitioners or parents are part of. So if you're working with this child, you're technically part of their environment. So the way that you interact with them and encourage them is going to make an impact on how well they perform their different motor tasks. And then at the bottom left-hand corner of our pyramid here, we have the task constraints. So these are specific characteristics of the task. So it could include the type of equipment that we're using, which there's a lot of great modified equipment that we can use with children with visual impairments and deafblindness. It could also be the goal of the task. So what are they trying to achieve? And it can also include any kind of rules or kind of parameters that we put on the particular activity. So if we look at this in relation to our children with visual impairments or deafblindness, some things to think about at the individual level is obviously their level of visual impairment. It can also be what type of additional disabilities they might have. So again, if we're working with someone with Charge syndrome, they're going to have a unique combination of characteristics. So we also want to take into account those as well. So we want to factor those into the way that we design our interventions. Another thing we want to think about is whether or not there's any parental shielding going on. So parental shielding is basically where a parent is maybe a little bit apprehensive about having their child perform certain activities or putting them in an environment to do certain activities because they're worried that the child might get harmed, which is a natural instinct for most parents, right? They don't want their child to get hurt, but it could get to the level where the child is going to be delayed because they're not given adequate opportunities to explore their environment. It could be also that the individuals working with the child maybe have limited motor development knowledge. They just aren't really knowledgeable about what could maybe work with their child. So because of that, that could be a little bit limiting. And then also just not providing a lot of opportunities for the child to perform different types of tasks, not putting them on their tummy, for instance, for tummy time, not giving them the opportunity to maybe build up that neck strength could be a little limiting. And so that leads to kind of at the individual level, not having as much experience as others. So it could lead to an additional delay. And then we have aspects of the task, which we can modify. And the task is one of the things that we want to think about the most when it comes to intervention is how can we adjust the task in a way that's going to help facilitate some of these movements, some of these milestones that we want to look to develop. So using, for instance, modified equipment would be helpful. The design of different types of activities, and then also some of the instructional activities that you can employ. So we're going to talk about a few of these. So one of the areas of research we recently looked into to kind of explore this idea of affordances in the home, because children, especially this young, that's their primary area where they're going to hang out for the most part is the home. Some of them might go on to childcare as well, but a lot of activity, especially during that first year, is going to take place in the home. So what we wanted to look at was, and we looked at this specifically with children with charge syndrome, we wanted to examine what were the home affordances like, what kinds of opportunities, what types of different tasks and toys and things were parents of children with charge syndrome providing, and how might have that differed from your typically developing child, just to see if there's any differences that are happening there. And then also we wanted to see whether or not there was a connection between the types of affordances provided at home and how well the child was progressing in their motor milestones. So what we use for this study is a measure called affordances in the home environment for motor development. And it looked at 5 different types of affordances that could be provided. So we have first is the outside space. So outside space includes not only the amount of space, but also the type of surfaces, as well as the type of different equipment and things that might be present in that outdoor space. Then we have inside space, which is very similar, except for we're talking about the inside area. So again, the amount of space as well as the types of surfaces and different opportunities provided in that space. Next is the variety of stimulation. So looking at basically the diversity of different types of activities that were provided. And then we have fine motor toys, looking not only at the quantity, but also the diversity of those fine motor toys. And then the same thing with the gross motor toys as well. So what we found, and you guys kind of got to see some of this data earlier, and Pam talked about it, was that the participants with charge acquired those motor milestones much later than their peers without disabilities. Some of them had not even progressed up to independent walking. And we did use that age range of 18 to 42 months that was shown on the previous slide that I forgot to mention. So even by 42 months, some of these children with charge syndrome were not independently walking. And then the major difference that we found with relation to the affordances is that the outside space was different, meaning that the parents of the children without disabilities tended to offer better outside space affordances than the parents of children with charge syndrome. And that's almost reassuring a little bit that that was the only difference we really found in that particular data. So it seems to be that they're providing similar types of affordances across those other 4 areas, similarly to our typically developing children. Now, as far as did we find a connection between those affordances and achieving those motor milestones? So we did not find a lot of connection, but one of the main ones we found was that age of walking for the children with charge syndrome was positively correlated with outside space, fine motor toys, and gross motor toys, as well as the total score on that measure. And this was an interesting finding because it seems to indicate that there was a later age of walking for children who were provided with more affordances. And that seems kind of counterintuitive initially. And the way we thought about it was it's possible that the children who were not achieving age at walking until much later, those parents maybe took it upon themselves to offer more affordances to hold almost as an intervention, as a way to encourage independent walking. So providing more outdoor space and affordances, which makes a lot of sense because a lot of walking happens outdoors. More fine motor toys, maybe for interest, maybe to encourage some of that. Same thing with gross motor toys as well. So it's some evidence to kind of suggest that, well, parents play a pretty big role, and maybe they're being proactive when they notice some of these changes happening or some of these delays. So our results really revealed that the home affordances are really important for motor development, and the parents can have a huge influence on that by providing encouragement, guidance, and regular engagement with their child. So I want to move on and talk specifically about some ways that we can encourage the development of these motor milestones. So I'm going to start first with some of the task and environmental strategies that we can use. So I mentioned before how we can easily modify these task constraints, so aspects about the task to help encourage more movement. So for the task, one of the things that we can think about is the type of objects that we provide, the types of toys. As I mentioned in that research, those fine motor, gross motor toys might be really important. So for these children with visual impairments or deaf blindness, providing brightly colored balls, high contrast types of objects, and other toys with sound sources, and anything with music. So something that will just stimulate interest. And of course, it's going to vary depending on the child, but you'll just have to kind of try things out to see what really resonates or really motivates that child. And then as far as the environment, that's another area where we can also assist the child in developing some of these skills. So we've mentioned previously about having non-slip surfaces, using different types of instructional strategies. With very young children, sometimes that can be a little problematic, especially if we're talking about infants. But again, a lot of these kids are delayed into, the next year of life. So it might be more prudent to use those when they're a little bit older, but we'll talk about some other ways that you can do that with infants. Parental involvement is obviously really big, providing that encouragement. Providing a rich environment, so multi-sensory environment that has lots of different types of activities. So especially toys with like lots of texture and color and sound would be very beneficial. And then also having some social interaction, whether that's with the parent, siblings, friends, other family members. And then just some specific toy considerations. So one thing you do want to keep in mind is safety, obviously, especially with infants. Babies with low vision tend to mouth toys more often than your typically developing ones, even though typically developing ones also tend to mouth toys a lot as well. So just keeping that in mind with whatever objects they're being given, making sure it's safe, even if they put that in their mouths, and nothing too small or things that are going to break off. Simple is often best. So simple objects like balls or blocks or things of that nature. Focus mostly on providing different types of textures, sounds, as well as, again, that high contrast to very brightly colored objects that aren't going to blend in with the environment. And then these would really help promote kind of the manipulation of objects if we're working on reaching and grasping, as well as movement. So having something entice a child to move toward it as well. So again, a toy with a lot of fun sounds that the child really engages in might encourage them to, crawl over to that or creep over to that object or walk to it.
Okay, it's Pam speaking again. Melanie, can you go to the last slide again? I just wanted to mention a couple of things about some of the pictures. So I included some pictures of balls that are available through the American Printing House for the Blind. The one is like the ribbit balls. And so if you're able to see the middle picture, so it's a ball that is a dark color with a light color contrast, and you can, it's easier to grab because you can grab the parts that are sticking out. It has a crinkly fabric in the ribs, and it gives like a more of an auditory component, so that's pretty cool. The sound balls, they have some different sounds or different beats and different options, and you can recharge those, and they're great for motor skills, sound localization. It can just be a great motivator too for the kids. So I just wanted to mention that those are all available through APH. So if you're interested. All right, go ahead. Okay, so I want to talk specifically about some instructional strategies. So we mentioned how important it is to really work with the infants and kids and to try to give them a rich environment and as many opportunities as possible. So I've got a progression for both crawling and independent walking. So for the first part of the progression, even as early as 3 to 6 months, just really encouraging that tummy time. So I have 3 kids, and my oldest absolutely hated tummy time. So I called it screaming time, because the more time I put him on it, the more he screamed. But you know, really trying to encourage more of that. It's going to encourage that upper body strength, that neck strength, and it's going to lead to crawling. So you want to place them on all fours, on their tummy. You want the infant to try to hold up on their arms. And one thing that you can do is, as they're lying down, try to push up on their feet with your hands, and that can encourage them to push you back with their feet. And that's going to help them get that feeling of progressing forward, as well as increase their strength in their legs. So when they get a little bit older, closer to 6 to 9 months, again, placing them on all fours. Then one thing is you could support them under their chest and try to see how much support that they need. So maybe a little more, a little less, depending upon how strong they are, depending on how much they're able to hold their body up. And this is also going to give them another opportunity to strengthen their shoulder and neck. So then they progress, again, around the same age. You could do a similar thing with a hand towel. So just kind of roll a towel or fold it up, and then put the towel under their abdomen and hold the towel. And sometimes it's just a little easier to help them moving around, depending on if they're a little bit better at moving around. If you really want to encourage more of that upper body strength, you can do more of a wheelbarrow where you're holding their back legs. Of course, you don't want to hold them up too high, but kind of judge what they can handle on how they're doing. But that's really going to encourage that neck, arm, and shoulder strength. And then finally, and what you really can do the whole time, honestly, is give them some type of motivator. Again, depending on their level of vision, they might really need something else that's encouraging them to want to move forward. So if you're just kind of doing these things and they don't really have that want to move forward or to go after something, it's going to take a lot longer than if they hear a toy that sounds really cool, or something they've played with before, or something that's bright colored, or just something that they're really encouraged by, that's definitely going to help them to progress faster. So I was going to ask to share challenges and tips, but I think that since we're kind of getting out of time, I'm going to just jump straight into walking tips, and then we can kind of bring that up at the end. I did want to mention, and this just to give the caveat, that is me walking with my youngest, and I'm saying not to do what I'm doing in the picture. So not that you should never do it, but try to really minimize walking with them holding onto your fingers and your hands or over their head. I gave a few different reasons for why it's not super helpful for encouraging independent walking. For one, you're not going to let them fall. And that's why they want to hold onto your hands, because they know that you're going to keep them up. And so that by doing that, they're not really learning how to make those little adjustments to keep themselves up. So you're also preventing them from using their hands, because you're completely removing their hands from the equation. So those challenges of standing and walking and different balance progressions, you're kind of losing some of those benefits. It also a lot of times encourages them to kind of lean forward. Usually they're kind of pulling forward, their arms are kind of coming backward. Again, that's not typical walking. That's not going to help with their balance. And they also tend to walk too quickly because they're leaning forward and they're just instead trying to catch themselves. So, and then finally, my last point of why it's not the best thing to do is once you really get that going, they're going to want you to hold their hands all the time. So it's kind of, it's difficult to extinguish that later. All right, so then I've got some other things that you can use to encourage walking, and this is Melanie's youngest, so Leo. So kind of like some of those towel exercises to encourage crawling, you could place a towel, kind of roll it up, place it across the chest, and help hold them up. So again, a balance aid, then they can still use their arms, and it can help them to get a little bit better idea of moving and foot placement, using their arms to maintain their balance without losing that. But again, you're going to keep them from falling, so they have that benefit. Another thing that you could do is walk with them with a broom handle. So you could have them hold on to the broom handle, you hold on further out from the broom handle, and just give them something to hold on to. That proprioceptive information is super helpful for them and also gives them a huge balance aid. Encourage cruising between chairs. Have some chairs set up with a little space in between it. So that's going to encourage them from getting that little area that's a little scary, and you can adjust the distance between those, start with them really close together and progressively move them a little bit further. Once they start to get better and better at that, encouraging them to walk to you, even if it's just one step or two steps. That's generally really exciting for them to walk towards you. It's very motivating. They can use a baby walker or different type of toy to help that. And the final one with independent walking, and this worked great. This wasn't actually my idea. It was my youngest. She when she would ever walk, and I unfortunately couldn't get my videos to work, but I have a video of her when she used to first walk. She'd always have two things in her hands. Like she'd usually get like water bottles or something, not heavy, but that really was a huge help for her balance aid, and just having those in her hands really helped her, even though it wasn't grounded. All right, so we have a video with more balance activities. I think I'm going to skip that for now since we're running out of time, but it is publicly available, and I'll show you where it's available. Then you can watch it on your own time. It gives balance activities. We actually were using older kids. They weren't young toddlers or infants. So balance is important across the lifespan. So it's certainly some things that you could use at any time. But I just wanted to finish with some different resources. Perhaps the one that I really want to push is our gross motor development curriculum. And like Melanie was saying, this is kind of a two-part series. In the next series, we're going to focus more specifically on fundamental motor skills. And this book really gets into that. Again, it's also free and available. We have a video that corresponds with the book. Both are free and available to you through our Capabilities website. So we'll show a bit of that and go over some of that in our next talk. But that one has a lot of great tips and strategies in it. And then finally, the American Printing House for the Blind. A lot of those products, like I specifically mentioned a couple, but there's a ton of different products, and a lot of them you can get with quota funds. Our Capabilities site is capabilities.org. If you click on instructional materials, there's lots of videos, and those books are available. You can also learn a ton about capabilities. Thank you, Erin. And Perkins School for the Blind also has some more videos and books. So So make sure you check out some of those, but I know we talked a lot and didn't leave a lot of time for questions. And I don't know what all, I just caught those last couple of things going through the chat, but all right. So thank you, everyone. And let me just see where we left off. Okay, so thanks, Alex, for posting that site. Okay, would the strategies we use for crawling and walking be done in conjunction with a physical therapist? It certainly could be done in conjunction with a physical therapist. Helping my 5-year-old blind student who tends to drag her feet while walking. So that kind of depends on if it's a dropped foot PT. That would be that's really hard to change. That would be something more to work on with PT, or if that's something more visual. Would it be appropriate to have them have a baton at chest level to encourage them to leave furniture surfing? So a baton, I'm just not sure. Or maybe you've mentioned that before. I mentioned the broom handle. I'm just thinking a baton is something really short, so I don't know.
Maybe so the hands can be more laterally placed as opposed to on top of each other,
Okay.
maybe.
Okay, so found my patients with lengthy NICU stays have had challenges progressing in these skills because of environmental barriers. Any vision strategies, protocols specific to NICU infants? Not quite sure what you're asking here. So meaning if they're progressing later, or I don't.
Is it because they haven't had any opportunity to move around? We do see that in children with Charge syndrome, for instance, when they're in and out of the hospital quite frequently due to having lots of different procedures done. And so because of that, that becomes an environmental issue. They're just not up and around as much. So I don't know if that's maybe.
Yeah, and keep in mind that action and perception really, they develop together. And so if they're not moving around and controlling some of that movement, then that's going to be further delayed. So understanding position in space and how that's associated with their movement. So just more encouraging and exposure. Please show the slide with where to find balance activities.
Oh, I can go back to that slide. Oh, it's on the camp abilities. Let me go back to. So it's actually under campabilities.org under instructional materials. You can find the balance video there.
All right, so, and we'll share, as I mentioned above, we'll be sharing this with the hosts and they can share it with all of you. See some good examples of motor development rich home environments. So really it's just having kind of a variety of options, just different toys that are motivating to kids, and everyone's unique. So finding what works for kids, and also understanding novelty is really important for kids. They might get bored with something, so take it away for a while and bring it back later, and now it's suddenly new again, and now it's exciting. All right. Oh, my chat is not working well.
Any other final questions? I think we got through
I think so.
most of them. Any chance the session was recorded? I believe it is being recorded. Yes, the textbook, the curriculum guide is free and the video.
Yeah, so it's available at the Capabilities website. So capabilities.org, and click on instructional materials. And there's a ton in there. Just keep looking and you'll find it. All right. So thanks, everybody. And I don't think we gave our emails. So
You want to put them
we're
in the
happy
chat?
to share our emails. And if anyone wants to contact us, feel free to.
Yeah, feel free to contact us anytime. And if you're interested in learning more about our institute as well, if you type in Brockport IMSV, I can put that in the chat as well. And all of our contact information is there as well. So Dr. Lauren Lieberman, who actually started Campability, she is the other co-director of IMSV. We have a great team, and we're always looking for collaborators and people who want to work with us. So but thank you all very much for attending. We really appreciate you taking the time out of your busy schedule and your evening, and we hope that this information was helpful.